At the first sign of a kidney stone, this is what you need to do. But let's first talk about what is the first sign of a kidney stone. It's usually back pain, okay? Usually on one side, a little bit higher up, could wrap around to the front part. It can also include lower abdominal pain on one side, but not just pain, but a deep, dull, aching sensation. That pain or achiness could also go into the groin because the kidney is connected to these tubes that go right down into the bladder. You can also experience blood in your urine. Also, you may feel the urge to urinate, but sometimes you can't urinate. You can feel nauseous or even the urge to vomit. Now, this is a short list of all the symptoms, but these are usually the first signs that you may have a kidney stone. Now, what happens with a kidney stone is these stones can develop in the kidney themselves or outside the kidney to the point where this kidney stone can obstruct this tube and cause a backup pressure that causes a lot of discomfort in the kidney because we no longer have the flow of urine through these ducts. Now, there's several different types of kidney stones. The most common is the oxalate stone, so that's what I'm going to focus on right here. All right, what will be the first and most important thing to do if you start noticing you have some of these symptoms? You need to drink minimally 2.5 liters of fluid. What is that going to do? That is going to really hydrate that kidney and allow for this space to open up a little bit more because there's going to be more fluid going out there and there should be less pain. The other thing that this is going to do, it's going to help prevent the supersaturation of this stone forming in the first place. In other words, this fluid is going to slow down and prevent the supersaturation, which is the concentration of this compound between calcium and oxalates. If you have enough fluid in your body, it's just not going to develop. And certain people that are prone to getting kidney stones, they need to be consuming minimally 2.5 liters of fluid every single day. And that alone could potentially prevent another stone from forming. Also, because we're dealing with oxalates, if you increase your citrates, that will help prevent the formation of these oxalate stones. So 1 cup of lemon juice per day wouldn't be a bad idea. Now, potassium citrate is another good thing to take. Number 1, it's an electrolyte, and it's in a lot of electrolyte powders. Number 2, it has citrate. And number 3, if you have a uric acid stone, this will help alkalize the urine to help prevent the crystallization of that type of stone. So potassium citrate will help both a uric acid stone as well as a calcium oxalate stone. As far as the diet, you want to avoid foods high in oxalates. Spinach, almonds, chocolate, Swiss chard, beet tops, peanuts, all the keto-friendly foods. If you happen to consume these foods, a couple things that you could do to prevent the formation of the calcium oxalate stones. Consume some calcium with it. For example, you had a spinach salad. Well, add some cheese to that salad. That'll give you the calcium. Or let's say you had some almonds or peanuts. Well, have some cheese with it. That'll give you a little more calcium. That'll decrease the risk of getting those oxalates. Also, the fiber in the spinach and the Swiss chard and the beet tops does have a tendency to reduce the formation of calcium to the oxalates as well. There are also 3 important supplements that can also reduce the risk of getting a kidney stone. The most potent inhibitor of kidney stones would be chondroitin sulfate. Berberine is another great remedy for kidney stones. Not to mention it's good for insulin resistance and a pre-diabetic. Cod liver oil has some really cool things. It has vitamin D, vitamin A, and it has the omega-3 fatty acids. All of those are great in reducing the risk of kidney stones. All right, there you have it. That's a wrap.